While the globe is dealing with a pandemic, mostly about physical wellness, it has had a tremendous impact on emotional wellness as well. And so I'd like for each of you to talk a little bit about what you're seeing as an HSAC professional and how Golder is handling that.
The core for me here is our value of caring. And I think right from the start of this pandemic, that fundamental core value of caring has been really strong in absolutely everything we've done. So we've had to really focus on individual needs of people, but also making sure that our commitment to health and safety is stronger than ever. And just changing the way we work, trying to make sure that we can be there for our people so they have the right work-life balance in a very unusual year.
Let's talk a little bit about how we've pulled Are You OK Day through the organization and how it's evolved.
Golder's caring value is why Are You OK Day has stuck and continued on and evolved globally. We've had some challenges, there's no doubt about that. Yeah, the idea of Are You OK, asking someone else that question has been challenging this year. So I guess, like anything we've had to evolve, and it's really evolved this year into as much Are You OK as Am I OK? So asking yourself that question, looking in the mirror, following the same steps, answering honestly, and setting out a path of action. Someone reminded me of when we used to hop on airplanes and they used to give the safety demonstration, and we'll get back there one day. We'll hop back on airplanes one day, but they always used to say, fit your own mask before fitting others. And I think that's really important, because if we're not okay ourselves, it's really hard for us to offer support to others.
You know, this self-assessment, are you okay, am I okay, is really something that yields a recognition that someone might be feeling a bit off balance. And when that happens, what can they do?
We can't always fix what people's issues are, but we can listen to them, we can have discussions, and we can ask the question. So we have a fantastic employee assistance program that provides the expert advice. It's having that work environment in place where people know that they can raise that they're not okay, and someone's going to stop and listen.
For me, asking the question is actually the easy part. Answering it can be really difficult, and I think in society, unfortunately, showing vulnerability is seen as a sign of weakness, and couldn't be further from the truth. We should be able to answer that question. We should answer that question honestly. And if we're not okay, let someone who cares about us know that we're not okay, and then accept the help.
Golder has just launched a global wellness program. What is the goal of that program?
People's work-life balance has really been thrown off this year. On one side, it's providing somewhere for them to go and access some really great resources that's there for them. On the other side, there's an opportunity to have some fun with it. And it's a way to get people to start interacting together again in that Teams environment, and just providing all of those resources for people as well.
So as we close out our conversation today, anything that you would like to share, any final words on World Mental Health Day and the importance of this day?
And I hear people say, I'm more efficient working remotely from the office because I can get more done, I can concentrate more. I think that's really important, but I think Mental Health Day is a day to recognise that whilst that is important, there's also an enormous importance on the value of community. And I see in the future our offices being this place of connection, and remote being perhaps the place of concentration.
You know, this year has just been a huge year of change, and we just have to be able to look forward and say, we're not actually sure what's going to happen over the next 3 months, but here's how we can look after ourselves.